And hi again, everyone. TJ Alls, I-45 now, and Galveston now, bringing you our latest edition of UTMB Health's Health Care Unmasked. Welcome to the show today. And obviously, here we are, and it's hot as all heck outside, and August is around the corner. Guess what that means? Back to school time. Oh boy, yes, I know. And how many parents are jumping for joy as the kids head off to school. But there's a lot you got to do between now and then, more than just shopping. You need to know what it takes to get your kiddos back to school and how to keep them healthy and how to keep them safe as well. And we've got three outstanding experts on with us here today to be talking about all of that. And we're going to have a conversation with them right after this words from UTMB Health.
UTMB knows when you're expecting, you may not know exactly what to expect. From that first embrace to all the milestones that follow, we know how important each stage of life is. That's why UTMB Health's obstetrics and gynecology physicians specialize in innovative women's health care through all phases of life. UTMB knows women's health. UTMB knows you. To find an OBGYN specialist near you, visit utmbhealth.com/women's.
And welcome back to the show, everyone. As you can see, everyone is on standby here with us today. Introduce our guest here with you. Immediately to my left here is Dr. Laura Raimer-Goodman, making her second appearance on our show. You made our debut show of Health Care Unmasked a few years ago. I was going to kind of surprise you to bring back your video, but you seem not wanting to have that. So she is obviously a pediatrician, lives in League City now with her husband. She has two school-age children. So not only this are you giving advice, but you have to follow your own advice, too, along the way. And has been at UTMB's Friendswood Clinic for 12 years and puts it, this is her quote, adores working with children and their parents on all pediatric concerns. That's always good to have a pediatrician that likes working with parents and kids on there. Also, and then to her left is Dr. Monica Thint. Also a mother of two boys. I like it. We got not just pediatricians, but folks to be in there. She's been a pediatrician 25 years now. Don't look at it. We graduated medical school at 10 and got into that. And, you know, one of the things we found out in talking with you is that it's a team effort. It's not just the doctor telling the parents or the patient what to do. It is about working together to make sure everyone's health. And then joining us all the way from Brazoria County is Dr. Maria Nguyen. And she works out of the Alvin office, and you've been there 22 years there now, Dr. Nguyen, and we're great. This is wonderful. We love when we get to bring in our Brazoria County folks in here with us today, too. And she, again, is works about working with her team, and that includes the parents along the way and in the local community. And we get a little bit of different perspective, too, because we have island-based, we have Friendswood base, we have Brazoria County base, and Clear Lake base, I should say. I said island-based, but and we normally would have Texas City base here, but Dr. Hayes is just too busy doing something with his kids, I think. No, Matthew, I'm giving you a hard time. You know I could do that. Matt's a great guy. So thank you all for being on here today. We do appreciate. And if you've got questions about what to do with your kiddos as you get ready to send them off to school, make sure you put them in the comment section. We'll be more than glad to have those to you, because this is our back to school primer. And let me just kind of start off with this. I'm gonna start with you, Dr. Goodman, and then go around here and then finish up with you, Dr. Nguyen. But the most important thing you think parents need to know before going back to school, right now, what they need to know now, school's going to start in August sometime for most. What do they need to be thinking of right now before they get their kids ready?
Well, one thing I think parents need to think about before the first day of school is making sure that their kids have had their back to school checkups. If your child needs an athletic physical and you haven't had that done yet, now's a great time to schedule with your pediatrician so you can get those forms filled out and out of the way before your child has tryouts for their sport.
Yeah, that's really important. Make sure you get that scheduled, because you try to do it the last minute, it's not going to work. Dr. Thint, for you, what's the most important thing you think parents should be thinking about right now?
Well,
get you a little closer to the mic. I'm sorry, I should have said it to you.
I'm a great advocate of vaccines, and I want for the parents to actually look over the vaccine records if they have it. If not, ask the pediatrician and see what needs to be updated before they go back to school.
Yeah. And Dr. Nguyen, how about you? What are you telling the parents over in Alvin, Angleton area about what they should be thinking of right now as they're getting ready for back to school here in less than a month?
Well, I would like them to consider. I think that with summer, it's been a great summer. They had a lot of fun. I'm sure a lot of people's sleep schedules have gotten off, especially with all those perhaps extracurricular activities, including maybe video games they've been playing. So I think it's very important to maybe consider regulating their sleep patterns slowly, so that when they get back to school, that they're not too tired, that they can't actually, go to school and learn. So to me, I propose that we get them back on a good regulated sleep schedule.
Well, and that's the tough thing, isn't it? Because all summer, I think it's in up through teenage years, it's a genetic thing. Like they know when May 31st gets here, or right after school lets out, and any kid and any teenager, their DNA just doesn't let them wake up before noon, and then they stay up all night. I mean, really, their patterns totally change over the summertime. And I wonder, since we're talking about that, Dr. Nguyen, is, I know, hey, you want to give everyone a break from the regular schedule, but should parents starting, how far out should they start working on that sleep pattern again after giving them maybe a little bit of a leeway earlier in the summer?
I think most school districts are starting in a few weeks. It's always easier to do things if you start kind of slowly. And, depending on, what recommendations you want to follow, there's some people that say that maybe you should start setting their bedtime and maybe going 15 minutes earlier every single day. So that way it's slow and that they don't feel it as much. And if that's the case, I don't think it's too early to get started now, to be honest with you. Because just remember that the younger kids, they still need 9 to 12 hours of sleep. The older kids, the teens, and I know they don't get this, but really the recommendations are to still get 8 to 10 hours of sleep. And again, in order to learn well, in order to grow, in order to be healthy, and just overall just generally feel well, I think sleep is really important.
Yeah, because you can't really learn or be very effective if you're asleep during class as well. And so what are your recommendations to parents about how to get those sleep patterns going with their kids? Because I'll just tell you right now, and it's on my mind how my parents handle it. It was just yell at me, go to sleep, wake up. I mean, that was it. There was nothing beyond that. That was the only advice I got from my parents about how to get to bed and how to wake up. What's your recommendation? I don't think it's just yelling at them to go to sleep.
Right. So I think the most important thing it first starts with is a good routine. So you should do the same thing every single night. And also, I think that you also have to realize that, you should make your bed only for sleeping. So for kids who do homework, for kids who want to play video games, you actually shouldn't do that, because then your body associates that with either stress or excitement, and you don't want that. You want bedtime to be a time where you're quiet, where things are winding down, and you associate sleep with your bed. And also the environment when you go to bed, it's very important. You may want to make sure that the lights are turned off, that the bed is comfortable, it's dim in there. And so I think that that's very important. The other things that I think is important, again, is to continue that routine. So really, even the weekends, they're a lot of times they get off their schedule, they don't sleep enough. So that, especially the teenagers, they want to catch up, if you will, over the weekend. But that's really not recommended, because again, that leads to napping, and again, it throws you off. So really, even on the weekends, it's important to not miss your bedtime, but even maybe 1 or 2 hours. It's very important to keep that internal clock or that circadian rhythm going. And also, again, it's tempting to, after school, if you're tired, to take a nap. But I think, unfortunately, naps also kind of lead to poor sleep habits or sleep hygiene, if you will. So it's very important to establish a routine and stick with it. And I think that I want to say a few words about screen time with that respect. It's
Right.
also very important to really minimize that, to 1 or 2 hours, and really that whole hour before bedtime, really not to do anything that may get you excited or increase your heart rate. Again, we just want to establish very good routines.
And the fact that you bring up about screen time, and by the way, folks, if you look on your screen, our great David Bethea, who sits in the studio, our producer here, has posted on there. It's called nationwidechildrens.org, and that's sleep education that UTMB can recommend to you to take advantage. But Dr. Nguyen, you're talking about screen time. Obviously, as I'm holding up my phone here, one of the things is, particularly a lot of phones now, if you turn it on, will give you warnings about what your screen time is. And one of the things I didn't realize, I'm obviously I work in the digital world, and so I'm on my phone constantly. And right before I go to bed at night, I'm sitting there scrolling through my phone and going over notes, making notes for the next day, and then I try to put it down and go to sleep. And actually, I'd read elsewhere that no, that's not a good thing to do, because of that. It's actually generating your mind at full speed, is it not, Dr. Nguyen? And we've got some agreements here with Dr. Thint and Dr. Raimer-Goodman as well on this, that screen time. How soon should you be telling folks, all right, off your phone, or off your computer screen, or off your iPad, or the like?
I think it depends on who you ask. I think it's safe to say that probably at least the 1 or 2 hours before you actually want to go to sleep, you want your body to sort of down regulate and sort of think about just sleeping and to sort of to do nothing else. So again, I think that we take that for granted. We're like, oh, I'm just going to check 1 or 2 things. But again, that's, this distracting. And depending on what it is, we may or may not realize it because it's so natural, but it may make you stressed out, So we don't want to associate that and be thinking about that when you're trying to go to bed.
Right. And Dr. Thint, you were agreeing with that. You were nodding your head about the screen time, and you were too. That was something you never had to talk about much with your kids in the early days, obviously. No. But nowadays, that's their companion. It's with them all the time. How do you do that without having? Because, back when I was a teenager, particularly, I wanted to be on the phone with my friends. Of course, it wasn't a mobile phone back then. It was the regular phone. So that was a little bit easier. You just unplugged it. Not as easy to do with the phone unless you take it away from them. So what do y'all recommend on that?
So it's about, I start discussing with the parents what the recommendations are. The most recent one would be, if you are on social media or on the phone for more than 3 hours a day, there's a higher association with mental health issues like depression, anxiety. And then the recommendation would be like maybe 1 hour a day on the weekdays and 3 hours on the weekend max. And this also gives the child opportunity to go out and do other activities other than sitting and just being zoned into the phone.
And the funny thing on this, and I'll say it's funny because I look at it, but even when you say, hey, go out, one of the things I notice with youngsters is that they have their phones on, and adults too now, but I should point out,
their phone with them.
They're standing right next to the person they're talking to.
Correct.
And texting them.
Correct.
Or social media messaging them. I hear you chuckling there, Dr. Nguyen, but that's one of the things that happens, and I find that fascinating to me.
May I please add about the when to stop the screen time before bed? Is that I don't want that pre-bedtime to be boring to them either. So I tell them, hey, there's a paper. There's a books you can read.
Get closer to your mic. Sorry.
You can read. You can actually read. And you can also read ebooks, or you can listen to audiobooks. And listen to lo-fi music, which is 60 beats per minute with no percussion. Go on YouTube, put in lo-fi music, and listen to that. Don't just unplug yourself from the phone and do other interesting things. And read anything you like, anything.
Right.
In our household, we use technology to our advantage. So our kids' devices all have some kind of parental controls on them. Mm-hmm. So we use the screen time app to shut off certain apps after they've used so many minutes on this particular thing or that particular thing, and it all shuts down an hour before bedtime. And anything that doesn't have an app like that, we hook into our Circle device, so it disconnects from the internet.
You can do the hub, right? The hub itself, and a lot of folks may not realize this. Particularly if you have Xfinity, it's a helpful tool, I would think, for parents. I see it on there all the time, the parental controls, and they can go and it shuts down, and And you can also disconnect specific devices as well from that hub. So yours is still working, obviously, along the way as well. Again, if you have just joining us, we're talking about getting your kiddos ready to go back to school. We are joined by, as you see on the screen there, on your right-hand side, that's Dr. Maria Nguyen. She's joined us, Dr. Maria Nguyen, joining us from UTMB Health. Then over here with us to the far left of me is Dr. Monica Thint, and then here to my left, no stranger to the show, Dr. Lauren Raimer-Goodman joining us here today. One thing I want to ask you, Dr. Nguyen, is one of the things that comes up, okay, I got a kiddo, it's almost got insomnia, can't get to sleep, and I want to find a sleep aid. Melatonin is getting a lot of talk right now. Is that really safe for kiddos? Because I'm now seeing advertising from melatonin gummies just for kids. And I wonder, is that a good approach? I know for an adult, I will take that, but I wonder if that's a good idea to use for kiddos.
I think, again, overall, nothing beats a good, solid bedtime routine. I think it's very important. But, for those ones who are still struggling, and again, it depends on the reason why you would give melatonin. But let's just say that, that you want to maybe help them just get to sleep onset, rather than maybe we're talking about like a sleep disorder or a problem like that, which of course that has to be diagnosed and treated accordingly. But, most sources think that it's safe, maybe for kids 4 and up or so. I think if you're talking about, but I think there are some preferences though, and maybe perhaps the other pediatricians can weigh in. But I think that if you're going to do something like that, I think you should still consult your pediatrician as to their preference in terms of what age to start, what the starting dosage will be, and how to increase that if it doesn't work. But again, once again, I would hate to recommend that unless they've done their due diligence and have established good sleeping habits. And
of course, for adults, it is one thing, when you have a sleep pattern, you'll get I know I have a sleep pill that I take every night just because my mind's always on and kind of racing. And I try to keep a good sleep pattern, 9 o'clock and then up, 5:30 of the day. That's my daily routine. Sometimes it's hard to do that. When do you know the difference, though? Let me ask all three of you this: of a kid or a teenager or kid who just needs to get a good sleep pattern going, and one's got a serious sleeping disorder. And what's kind of the trigger for you on that to say, as a parent, to go, all right, let me go talk to our pediatrician about this. And do we need to prescribe something? And that gets a little iffy when you're talking about youngsters starting them off early. Does it not on prescribed sleep medication?
So I usually tell families, if there's something that's concerning you, like it seems like your child's not breathing well while they're asleep at nighttime, if they're like snore, pausing when they're breathing, gasping and shuffling around, like they can't get good rest, that's a good thing to talk to your pediatrician about. For kids who just have a hard time falling asleep, the first thing really is to do a good sleep routine. No screens for an hour before bed, a wind down routine, and bedtime at the same time every night. And most of the time that really will fix the problem. If it is not fixing the problem, that's another good time to go and talk to your pediatrician. And just to know about the melatonin too, I let my families know that there is some data that shows long-term use of melatonin can make you dependent on it. And so maybe for short term, like when you're trying to adjust from that summer schedule back to a school schedule, if you need it for a few nights, maybe it can be helpful. But I encourage people not to use it every night because you don't want to have to use it.
Right. And Dr. Nguyen, how about what do you tell parents? Have you ever had an instance where parents said, I think I need to give the kids my sleep meds, get some sleep meds?
So I do think that it is tempting. And so people start asking about questions about not only just melatonin, but, can I give like some Benadryl or so? And so, I think it hasn't been established that not only is it probably not beneficial in the long term, but it really isn't very effective. And then you start introducing things like side effects. So, and just to add to what Dr. Raimer-Goodman said, I think that, we have to make sure that sometimes sleep problems aren't a symptom of something bigger. So, what Dr. Raimer-Goodman was referring to is probably, obstructive sleep apnea or sleep disordered breathing. But, it can be a symptom. I mean, are they anxious? Do they have depression? Also, are we dealing with something bigger? Could it be part of, maybe they have undiagnosed ADHD and that's why they can't, get to sleep. So I think that the sleep discussion is actually very, very complicated. And sometimes, it can be a sign of something much bigger, So I think that, to me, if it seems like it's just doesn't feel right as a parent, something is just not right to you, I think that's a good time to go have a conversation with your pediatrician.
And never, ever try to dose it on your own. Like, oh, hey, I take sleep pill, give it to your kid.
Oh gosh, no, that would be a disaster, especially with
no. I mean,
histamines
it's
or
common
Benadryl.
sense, but and obviously you never should do that because it's made for your size and your age and
Right.
very
So
specific.
TJ, melatonin is something we make naturally from
Mhm.
the pituitary gland, and if you supplement it outside, we stop making it and reduce the amount that we make it. So
I never knew that. So if you add to that, your body's going to say, well,
Correct.
there's enough there, so I'm stop creating.
Correct. So we don't know the long-term effects of melatonin, period, on kids. Short-term, it is fairly safe if it's less than 5 milligram. I've heard parents give their children up to 10 milligram. So that is something uncharted territory. And we really don't know what the long-term effect is. So I agree with both the doctors here that if you're going to try to think about melatonin, first do your due diligence, get that sleep hygiene going. That is really important. And if you can't, then talk to your pediatrician and get some advice. And it may even not be physical issue, maybe emotional, mental health issue. And kids who can't sleep for 1 to 2 hours past their bedtime are thinking about so many, maybe thinking different things and are worried about things. Or even if they fall asleep, there's some children that wake up several times during the sleep cycle. So those are definitely something that you should talk to your pediatrician. And we do have a sleep clinic, a pediatric sleep clinic. That is something that you may be your child may be needing to evaluate at the sleep clinic and maybe do some sleep studies if needed, rather than band-aid approaches to just give melatonin and see how things go.
You are watching UTMB Health's Health Care Unmasked. I'm TJ Alt. Thanks for joining us here today. We've got a lot more to discuss, and we're going to do that here in just a little bit after this word from UTMB Health.
UTMB Health knows that when you need advanced surgical care, you want a specialist who's an expert in their field. Our surgeons provide innovative and advanced treatment options for adults and children, for neurosurgery, GI, heart surgery, ENT, urology, and more. UTMB knows surgical care. UTMB knows you. To find a UTMB Health specialist near you, visit utmbhealth.com.
And welcome back to Healthcare Unmasked. I'm TJ Alt. Glad to have everyone on with us here today. We are talking about getting ready to head back to school, and we've got 3 of UTMB's best pediatricians on with us here today. In the studio with us is Dr. Monica Thint and Dr. Laura Raimer-Goodman, and then joining us from Alvin is Dr. Maria Nguyen. Joining us here today. And now, Dr. Goodman, we're going to start discussing this with you, because now we get into an area that is so important, but it's sometimes hard for parents to keep track of, and that's vaccines. What's required, what's recommended, because there's the state requirements, and then you have the ones of, well, it's your choice of what you want to do on this. And then obviously I'm going to bring up the one that everyone, that firebrands still, but COVID. So let's start with that. What is there a requirement from the state to have a COVID vaccine before returning back to school?
No, there's no requirement, and it probably won't be in the foreseeable future for anybody to have COVID vaccines to go to school. But every year, we're going to encourage everybody to get both flu and COVID vaccines in the fall. So if you haven't gotten up to date on your latest COVID booster, check in with your pediatrician and see when the right time for you to do that is. But what we're seeing with data is that just like with flu, we need to re-up our protection every year on COVID. And we do that in my family. My kids have tolerated it great. They also feel like that's a way that they can not only protect themselves, not miss out on school and fun stuff for themselves, but also a way that they can kind of protect their friends and family and keep from spreading so many germs around. Because we all know, as hard as we try, schools are just a pit of germs.
Yeah, they are. They're petri dishes. The kiddos are, as the joke goes with a lot of teachers of going in. But that goes into before we get really into the vaccine here. There are some simple steps that you can take.
Oh, yes.
The same steps you would take to prevent the flu spreading around or a cold spreading around are the same steps here for COVID in most cases, which is wash your hands.
That's right. Hand washing is one of the best things that you can do.
Don't touch your face.
Prevent any germs.
Yeah.
That's right.
Those two right there would help a lot of it. Take some self-discipline, but along the way. How do you handle, though, when a parent comes in and they ask for your recommendation? Because for some people, there's a line between recommending and telling. And that there's some politics that has to go along with this. I say politics, not in the political election type, but just how people react. And I'm going to ask all of you here that I'll start with you, Dr. Goodman, and then go with you, Dr. Thint, and then to you, Dr. Nguyen.
Well, I always think it's really important for parents to feel well informed and in charge of the decisions that they're making for their children. Being a pediatrician is about being a partner with parents and helping them navigate all of the information and data that is out there and kind of weed out, the voices that are just there to scare you and not really to give you good information. And so, like I said, I've got my own kids, and you better believe I try to stay up to date on all the data. And as pediatricians, we're never trying to recommend anything that's harmful to anybody. We're all on the same page. We just want to protect your kids and give them the best chance of having a healthy and productive and good life. And so for parents who come to me asking for my recommendation, I go over, what are the side effects? What are the benefits of getting the COVID vaccine? If they have questions about it, I'm happy to sit and chat with them for a while and kind of give them handouts that go over all the research data that we have so far so that they can make a decision for themselves that is well informed. And then we'll support that decision that they make.
Dr. Thint, how do you make that approach?
So I actually look at, two categories, very rough categories. One are the parents who are actually seeking information, and they do want a recommendation. They also want to take control of the decision making after they get my input. And then there's another set of parents who've already decided, who have had information from other sources. And so they usually don't seek information from us anymore because they already have made up their mind. So I still, as my responsibility to work for the patient, that's my main responsibility. I work for the kid. To protect the kid, I will still inform them the benefits and the side effects of the COVID vaccine. And then I would keep an open mind on their, respect their wishes, and I would leave an open discussion with them. Let me know if you have any more questions. Message me or call me. We can talk some more. But for the first group, I will definitely, lay out this and this, this and this, is good, this and this. It can happen. This is how good the vaccine is, but there's limitations to it. Is it safe? Yes, it's safe. So it's still using our immune system. It's not, and the vaccine does not stay in a system for a long time, and it's very safe. So, and I practice what I preach. I take the COVID vaccine myself. My family does. My children do, and so this helps to protect. Even if you get COVID, it may not be severe because COVID does not come alone. And during that season, you may have COVID. We've seen it, right? COVID and flu. They're horrible. COVID and RSV, COVID and strep, right? All of these can be together. And so your body is already fighting one. So let's try to maximize our defense system, with the vaccine,
Yeah.
And
Dr. Nguyen, what's your approach when they come in? And Dr. Thint brings up a good point. There are some parents that come in, they already have their minds made up, but you still give the information to them, but I guess it's the kind of judging how far you go with that sometimes. But how do you handle that over in Alvin and the Angleton area?
If I may clarify the question. So is your question, how do I handle parents and vaccinations, or how do I parent who are reluctant to do vaccinations?
Both, actually. We'll start with one. You start with either one you want to go to and the other, because I think I do think there was this kind of an unfortunate thing that came of, as I said, the politicization of healthcare in many ways. Of there were many folks who basically said that the medical community is trying to shove this down our throats, and they don't even know. And I know of every doctor I ever talked to is that they know what they know, and they tell you what that is, and it may change 2 months from now, depending on early on. I mean, now as studies go and as we see the effects, okay, it's this. But let's just first is that when they come in for if you're asked about, hey, I know this is the list of what we have to get, but I've got my 10-year-old here. What's the recommendation you have about that? They'll ask you that question, and what do you say?
So my approach, I would say, would be very close to Dr. Raimer-Goodman's. Like, I feel like we are a resource for information. And I feel like information is key. And having said that I do want to inform them that I think it matters where you get your information. So we want to make sure that we have it at a reputable site. And actually, I even make some recommendations as to where I think they may consider doing their research. And I saw that one of Dr. Raimer-Goodman's references were like the Mayo Clinic. And I actually use that myself. I said, for folks who want a little bit of detail without having it to be very technical, I think that's a great source. It is for adults, but it does give a lot of good general information, and for very specific pediatric stuff. I like the Sanford Children's Hospital, the Lucille Packard. They have very good stuff for children specific. So, and sometimes if people are on the fence, they're not sure, I say, hey, listen, let's talk about what we know. Let's talk about what I know, and why don't you do some research? Why don't you go look it up yourself? And please just do me the favor of using, a reputable site, or go to the CDC, someplace where we know that the information is good. And then, I strongly recommend this. I think that, it helps keep, your children healthy. It helps keep kids around them healthy. My own children have had every single vaccine that I'm recommending to you. I've had every single vaccine that I recommend to you. However, I understand that, especially with the COVID vaccine, I do agree that you need to get it, but it's new, right? We quite frankly don't have the data for 20 years, right? And so I can understand that there are some misgivings about that. I mean, that is very fair, right? And there are some questions we can't answer, so that feels anxiety, if you will. But having said all that, and so I can understand, and I understand that perhaps today you don't, you're not sure, you don't want to make a decision. And I want you to be very comfortable whatever decision you make. So therefore, you can come back and see me again. We have nurse visits. If you change your mind, you can come back tomorrow and do it. Go discuss it with your significant other. And so I think for me, I want to give them information. I want to, in the end, make a joint decision. And I want folks to really, quite frankly, be very comfortable. In the end, do I want the world to be vaccinated? Yes. But, unfortunately, given the climate, I don't know if that's entirely possible, but I would like to keep those folks engaged. So I think it's better than perhaps saying, something that perhaps, maybe I inadvertently alienated them, So I'm hoping that we can still, like everything else, I think it's important to continue to have the dialogue. So that's my personal approach to it.
Right. And a question a parent asked me the other day, I thought was quite interesting when I said, hey, we're going to be talking about this topic. And she had a very interesting question for me. She says, yeah, I understood it getting the vaccine for my kids the last couple of years because that's when we have everything going. But things seem to have calmed down now. It's more like the flu, right? And I said, well, it's to the stage now that, yeah, we can get your vaccine and then, you get a treatment, like Paxlovid, something like that afterwards. But I said, well, now we don't have to worry about it as much. I said, well, do you worry about the other vaccines? Do you still get your kid the flu vaccine? He says, yeah. I said, well, I would think that the recommendation is, yes, still do that. But where are we? Because I know I've lost track about what adults are supposed to be doing right now. And I tell folks this all the time. This is just my personal decision. If I could, I'd get a COVID vaccine every single month. because I'm out in public all the time, and I'm just, I see people that go, oh, I had an intern of ours who, she had the vaccines all the way through, took a trip over the summer, came back and popped for COVID. She wasn't feeling well and did, but because she had the vaccine, I think, wasn't as bad, but still, and I actually realized in like a month that's come down with COVID. So there may be some people thinking, oh, I don't have to worry about it as much now. And that's in some ways a kind of a yes, but at the same time, it's actually a pretty good no, is it not? I mean, what is the recommendation right now for kids? I mean, that you're supposed, if we follow on the vaccine schedule, like as I said, I've lost track of when I'm supposed to get the next booster and everything else. What is the recommendation?
So for any child who has not yet been vaccinated, the recommendation is to get one of the newest COVID vaccines. That's the bivalent. And they are updating that for the fall, so it'll be more targeted to what's circulating around in the community.
It's a 6 month and up.
That's for 5 years.
5 years.
And up.
5 years and up. Okay.
For 6 months to 5 years. It's still recommended that they get the schedule. It's 2 for Moderna and 3 for Pfizer.
See, I didn't even know for the kiddos the third on the Pfizer on there. So that's one of those things, a bit of information I think that gets out there, that there's so much that comes at us. And I think some of this too, some of it was coming at us at one point. It was like drinking water from a fire hose. It's like, what's the recommendation today? That's part of medicine too. Is like, as we learn how it's more effective, is it not, Dr. Thint?
And there was a newsletter from Texas children, uptick in admission with COVID. I believe it's 1.5% last week. So it's coming, it's coming back, and yes, thankfully it's not as bad as the last 2-3 years. So we have the tools now. We are better equipped to prevent infection and utilize it. And also I tell my parents that I am ethically and legally responsible for your child. If whatever I tell you, I have to stand by it. And you can come back anytime and ask me if I did something, told you something that's incorrect. I have to be responsible. What you see on media, what you hear, those folks are not directly responsible for the child. So
it is a little bit different when we're talking about that. And Dr. Thint, I'm going to have you talk straight into the mic. I know I'm doing this bit myself. And now it comes into, you mentioned this in the talk before, in that one of the things, COVID's one concern, but really amongst youngsters, RSV. I until we had this kind of a side thing to COVID in many years, for some time, I wasn't hearing much about RSV at all before COVID came along. Right. And then all of a sudden, with kids, we're hearing about RSV. For those who may not know, let's explain what RSV is so people understand it, and why are we seeing it more and more prevalent than before?
Yeah. So RSV stands for respiratory syncytial virus, and this is a particular virus that loves your nose, throat, your bronchioles, which are the small airways in your lungs, and it likes to protect itself by making large amount of mucus to protect themselves from our immune system. So when children have RSV infection, or adults have RSV infection, we get pretty bad sinus congestion, cold, and it extends down to our lower airways very quickly. And there are people that are more at risk of getting lower respiratory infection with RSV, and these would be premature babies. This would be children under age 2, and also children and adults with chronic respiratory issues like asthma, COPD. So they can get sicker than people who have a healthier respiratory tract. So that is so RSV is not new. RSV is not. It's been around for ages, and it's more coming into highlight because 2021 April, I believe, is when 2020 April, when we had very unusual outbreak of RSV during the spring. And that's where we saw the highest number of mortality in children with RSV. And this is all part and parcel of the COVID landscape, where everything got different. The flu becomes, year round, or you see flu in the summer. And RSV, which wasn't as severe for some reason, came back with a vengeance in April. And so there's now a new RSV vaccine, an FDA being looking at, and will be approved soon. And so we are very happy to see that, because there's no real cure or medication directly to treat RSV. So it may be just it's a spectrum of where you can have just a mild symptom like a rhinous congestion cough, to a severe like pneumonia, or even bronchiectasis, which is the destruction of the lungs. I've had one patient with immune system issues. Half the lung was pretty much scarred out, and he stayed in the hospital for at least 3 months. So it can be a whole spectrum of things. So, it has been around, but we are now recognizing it more because of the landscape changing a little bit. But again, it can be preventable. It can be preventable easily. Hand washing, hand sanitizing, covering the kid's mouth when they sneeze or cough the right way in the elbow rather than in the hand. Yes. So, and wash the hands right after. So these are the things that parents know. Also expect that this will be a longer cold, longer respiratory infection. So we can help do the supportive care for these symptoms. But again, go to your pediatrician. Look at the signs. That one of my questions that I want parents to ask me is that, when is a cold not a cold anymore? Is
Right.
When after 3 days your child should be somewhat better. If after 5 days they're still coughing, or if the cough is getting worse, it's not a cold, not just this upper respiratory infection anymore. So that's when you need to go and check it out. So RSV is one of those viruses that gives us a lot of long-term meaning more than a week's worth of illness. So.
And Dr. Nguyen, I see you're ready to chime in on this as well here.
Oh, no. I just, if I may add, I just want to say that in general, I think that, Dr. Thint gave an excellent discussion about RSV, but I think, but most cases, though, I think RSV, it really just kind of causes some mild, cold-like symptoms. Most of them are really not severe. They don't lead to either wheezing or more severe disease. Most of the time, it causes a very, very mild symptom. So I don't want us to, in her information was beautiful, but give the general public to make them
right
super fearful.
It's still kind of an at-risk thing as well about where
correct.
the hospitalizations come up. Right.
Exactly.
Those are few and far between. I think most of the time just cause you to have a cold and not feel very good, even in the younger kids. But it is true that some people get unlucky and just sort of get complications and just get very sick, But in general, it does cause mild symptoms.
Yeah, and you had talked about when is a cold not a cold anymore. I can't seem to tell myself. I can't tell if I'm having a cold or I'm having a bronchial infection or I'm having allergies, which I don't normally get. But now with everything that's changed, with it's dry as it's been. There's stuff that's blooming. I don't think it's ever bloomed before because it's been dormant all this time. It's just now had plenty of heat in cooking in there. There's just a lot. I feel there's a lot more attacking our respiratory system now than we ever had. Maybe I'm imagining that, but I hear that from people all the time. I'm hearing more about summer colds and summer bronchial infections and those. Are y'all seeing that amongst kiddos as well during the summers?
Fair
These
amount.
summer months?
Yeah. Generally tell parents it's a good time, to check in with your pediatrician if your child is having significant symptoms like high fever, ear pain, congestion that's lasted more than 2 weeks, or if they're having any kind of breathing issues. So breathing hard and fast, or acting like they're working harder to breathe. Breathing more than 60 breaths a minute, or making funny noises when they breathe, like wheezing. Those are really good times to go be seen that day.
You're watching UTMB Health, Health Care Unmasked. I appreciate everyone joining on. We're going to take a break and come on back. When we do, I want to get into some more of the general safety issues, but one of the things I want to talk about is mental health. We actually have a viewer who wants to get some questions asked, and you were wanting to talk about jitters, first day jitters and the like. And we'll be coming back and talking about that in about 30 seconds.
There's nothing more important than quality health care for you and your family. That's why UTMB Health is in the communities where you live, providing easy access to innovative care. At UTMB, we know our patients need personalized care to lead healthy and fulfilling lives, providing everything from primary care and specialty care to urgent care and emergency medicine. UTMB knows healthcare. UTMB knows you. To find a UTMB doctor near you, visit utmbhealth.com.
And hi, everyone. Welcome back again to Health Care Unmasked. This is presented by UTMB Health. We're having a wonderful discussion about getting your kids ready to head back to school. We are going to, by the way, go over the mandatory vaccine list. I want to do that kind of at the end where everyone, that's the last thing they get to write down. Make sure, okay, let's get the requirements up, because we've dealt a lot with kind of the questionable, questions that are asked and the like. But one area that I think we're hearing more and more about is adolescent and teenage mental health and emotional health. I discuss that a lot. And you put down, Dr. Goodman, about first day jitters in there. But one of our viewers here, Wing T, said, what are the normal signs of anxiety when going back to school? We would call it jitters before, I think makes sense. What signs of anxiety should I worry about? That's a really good question, because that could go so many different directions, could it not? And this is why I'm going to get all three of y'all involved with this one. But I'll start with you, Dr. Goodman, about that.
Right. So it's very normal for kids to be nervous about the first day of school, because that's a big transition for everybody, especially if you're making a transition to a new school, like starting kinder or starting middle or high school. So there's a lot that you can do to kind of help support your kid in that moment. One of the biggest things that you can focus on is trying to help them feel prepared and kind of involved and in control of what they can be in control of. So for your littles, if you can make a point to attend, meet the teacher, and kind of get to know the classroom, and help them set their expectations for what the first day is going to look like. If they can be involved in picking out school supplies, or packing their backpack for the first day, or picking out their outfit, little things like that can really make a big difference. If you can share lots of positive stories about good things that you enjoyed about school, or wonderful teachers that you had, or good friends that you made at school, those are all ways to kind of help set your kids' expectations on a good track, and help them calm the first day jitters. Our littles are also magical thinkers. So our 4, 5, 6-year-olds going into pre-K or kinder, sometimes a little bit of magic can help calm their jitters. So if you have a lucky penny to pack in their backpack for the first day, or some jitter glitter, some little glitter sprinkle on their pillow to help them get a good night's sleep, or a special prayer that you say, or something that's kind of calming for them, totally fair game.
Simple, a simple game.
Mm-hmm.
It's simple. I call it a game, but a simple step that you could take. That, like you say, for the littles. I like how you say it, the littles. No, but that's true. I think a lot of times what we think about. But I think also too, is it not, accurate? I'm going to say this out. Obviously, we are seeing things like mass shootings on TV all the time, or violence in schools and the like. And I think, and it's almost as if when you get to that middle school, which is middle age of students, I guess, but middle school and high school, that's when those emotions are kind of trapped in. And if you keep asking what's going on, that's not going to get you an answer. But there is anxiety. There are concerns. I know to this day, at even though not one student who attends Santa Fe High School now was at the campus the day the shooting happened in May of 2018, but still they were at school somewhere. They know it. They watch the news. They'll see stuff online. And so there's a different type of anxiety there, but it's still anxiety overall, because just overall what they're getting bombarded with social media wise and news wise, they're seeing a lot of that really bad things. So what is y'all's recommendation of making sure, one, you're addressing that before it manifests itself in a bigger problem down the line?
I would, first of all, minimize their exposure. I mean, they will hear it, but do not, try to minimize it as much as possible. And one way to, I guess, with elementary as well as middle and high school would be, especially elementary school, to reduce the jitters or anxiety for anything would be rehearsal, dress rehearsal. So we're gonna like do it like at least once. So we're gonna go to school at this time. This is a backpack. Let's go. So would you drive the route and you go to the school? This is where you're gonna get off, and this is this is how I'm gonna say goodbye. And we can pick you up at this time after in the afternoon. So that way they already know the routine of the steps of the. And then when we do the orientation at school, I would maybe even ask the teachers what the strategy for if there's an emergency. What is the strategy? If they could outline it, because that would, if I'm a parent, I'm going to be also very anxious about this situation.
Right.
So I want to know how that's going to be addressed by that school and the teacher. So after, I think that's something we need to discuss with the teachers and also explain it to your child in the most simplest way, into calming way, that, hey, listen, this is what we're going to do. You're going to go, these are the steps you have to do. And then there are people there to help you, protect you. Just allay that anxiety.
Right. I think one thing, go ahead, Dr. Goodman.
I was just going to say, if your child's anxiety is getting in their way of being able to function, so if your child's having episodes of crying, if they're not able to talk to friends at class because they're too nervous, if they're not able to participate in extracurricular activities, if they can't sleep, if their eating is off because they're too nervous, those are really good times to talk to your pediatrician, where it's probably more than just jitters at that point.
Right, and that's what Nguyen was asking about. It's like, okay, there's going to be some anxiety. We know that going back to school, no matter what the situation is, it's just a lot of stress there. But what's the difference between that and something that should be actually you're addressing with your pediatrician? And as I say, I separate off because several mental health experts and counselors who from the Gulf Coast Center were wonderful, sat down with me a couple of years ago, kind of explained there's mental health, and there's also what we actually talk about, emotional health, where there's actually this kind of lack of understanding your emotions and how to, at some points, I think it's adults, we have that trouble too, but lots of the time we're compartmentalized. Well, it's just this and this, that. How do you know when not to ignore what you're seeing in your kids? That's a tough one, isn't it?
Yeah. So again, I think the major red flags that we need to look out for is how much are these issues getting in the way of us doing what we need to do. So are our grades dropping because we can't concentrate in class and we can't focus on what we're doing, or because our emotions are making it hard for us to be able to get our work done? Are we withdrawing from friends and family groups and wanting to isolate and spend lots of time alone? Are we having trouble sleeping, having trouble eating? And it's never wrong to ask direct questions. A lot of parents worry, like, am I going to put an idea in my child's head by asking them, are you feeling anxious, or are you having thoughts about hurting yourself? Are you feeling that overwhelmed? You're not going to put thoughts into their head. There's good research data that shows that. And that any teen who is in that place where they're so overwhelmed that they're wondering how they can continue to go on, they get relief when other people ask them those questions. And so if you're really worried about your teen and they're showing you signs that things are not going well, they're not able to function and do routine things that we would expect them to do, like talk with friends and get to their classes and sleep well and interact with other people, then ask the questions. And if you're worried about it, bring it up with your pediatrician and they can ask the questions as well.
And Dr. Nguyen, I want you to chime in whenever you feel like you want to.
Sure. I definitely agree with that, but I want to say a few words about, parental involvement. I think it's natural for the older kids to want to spend some time alone. And I think it's natural for us to maybe give them a little privacy, but I would like to make sure that we as parents are knowledgeable, about what our children are doing, that we are always engaged. And, for instance, this ties into the screen time, but like for my children, at all meal times, there is no screen time. We have to sit down, we have to talk. And that's my time to touch bases with them. Hey, how's everything going? How are you doing? What is going on? Tell me about your day. What has changed? Tell me about your teachers. And I do agree that it's important for us to be involved, for us to be knowledgeable. And that way, if there's a change in the routine, and again, just not any change, but any change that truly seems to be much different than before. Because if you have a baseline, you also know about changes. And the other thing too is if they become very withdrawn, that's a big sign. It may be for whatever reason that it's telling you something. And I think it's very important. That's a time for you have to sort of, as a parent, identify what's going on and to seek help if you think that something is more is going on than just being a teenager.
It is, and there's many ways in which I think we have, as a society, have kind of failed, even though we've been told over and over and over again what to look for.
Mm-hmm.
We kind of fall back to when I was a kid, all I do is, it's kind of like we talk about injury. It's like, okay, just shake it off, but it's not the same on the mental or emotional side.
May I add one thing? We lead by example. So when you are with your child, put away your phone. Be there in that moment with your child. Focus 2 minutes, 3 minutes, 5 minutes. There's evidence that even pets feel that when you are on the devices, they feel neglected. So same with babies. So if you're going to be there with your child, be there with your child, both physically as well as focus-wise. And then they will understand that, because if you're on the texting and talking at the same time, they will catch what's wrong with me doing that. You do it too. So so please be there.
Well, it also goes to go ahead.
Around to one more thing Dr. was saying. Preparation goes a long way, even for our older kids. So it's very normal for our middle and high schoolers to have those first aid nerves. Doing simple things like making sure they have a printout of their schedule, and maybe even printing out a map of the school and having them kind of trace their route from class to class. Little things like that can go a long way to helping them feel more confident on the first day.
And I know this is going to sound like a really silly question here, but we talk about social media.
You're talking to pediatricians.
Yeah. Well, as I say, when you talk about dogs, I don't have human kids, but I have 3 furry friends. And when I'm on my cell phone, yes, they all knock my arm away. They know what I'm doing is not paying attention to them. I wonder, though, I've always questioned this. And I think it's cute at one thing, but the other side is not. On the first day of school, all those photos flooding social media, many of these kids look miserable doing that. Now, I don't know if they're just playing it up, but and I'm not trying to insult anyone and say, hey, if you want to, because you're proud of your kids, I get it, and everything else. But some of these kids, I'm looking at and I go, this kid does not want to be in this photo, doesn't want all their friends to see him do this, doesn't want to see their mom doting. Wow, you got it. About 9 years old is when you start doing the whole shove mom and dad away, right? And I just wonder, and I know it seems innocent enough, but I wonder if that adds sometimes to that first day jitters. Is like, I see Joey's wearing that shirt again, and they've already seen it when he gets there. Hey, why'd you wear that shirt, Joey? That your mom picked that out for you. I just wonder if that opens. And I'm not telling anyone not to do it. I've always wondered myself. Only because there's some of us that actually have some fun with it too, that we take photos of our dogs on the first day of school. Here's our dogs on the first day of school, just as a joke as well. But
as a parent who has school age kids and who loves taking those first day photos, I will say that there's a couple of things that we really need to think about as parents before we post those photos. One is, what information are we sharing online about
that too,
our
for
children?
Safety?
For safety, exactly. If we share our child's name and age and the school that they go to, that gives a lot of information out that we might not necessarily want to be public information. Also, I think it's really important in this age of digital media for our children to have some autonomy and some consent over what goes online, particularly our kids who are old enough to understand those things.
Yeah.
And so in our family, we have a rule. I don't post any photos online that a child has not consented to being posted online. So they have to agree that it's okay for me to post, and we only share those with close friends and family. And not as a public thing. And not as a public post. And we even have tiers. If I'm connected social media wise to any of their friends, then we only share those photos with parents, grandparents, adult friends, and not necessarily their friends.
Which is how it used to be anyway. You would just, take a photo and put it in an album and show it, but now it's out to the whole world. But you come at a different approach on how you're saying it, the consent. I think that's important.
That's wonderful.
So from now on, parents, when you take those photos, I want to see the consent form. No, I'm just kidding. But I have just wondered about that over the years. I think it's I enjoy looking at it because I'm proud of my friends' kids, because they're, everybody I know has smart kids. They're not a dumb one in the whole bunch, as I'd say, but they're great kids. They're smart, and they're proud of them. But I've always wanted to I'm not so sure the kids the safety part. I hadn't even thought of, and I should. Now I have noticed that some parents, for example, they don't take the photo until they get to school, and they'll just say my kid or Thomas. If you know the parents, you're going to know the kid. And from that, so to try to protect it there. But I did find that kind of interesting. Dr. Nguyen, what do you want to chime in on this? I know it sounded like a silly question a month, but I think I got some great responses from everybody on this one.
With respect to posting
first day photos.
The first day. Oh, I think Dr. Raimer-Goodman brings some good points. I'm going to be very honest. I'm not really a poster. I don't really share a lot of things, online. And so I think it's absolutely wonderful that she has, I agree with the recommendations. If you're going to post it, please. I'm very big on safety. And if I think it's a great idea to make sure that, everyone's in agreement with that, and not to, if you're going to share, then make sure it's something that they want out there. So I think that's great advice.
Well, I think it goes to something you said earlier too, is getting your kids involved in decision-making process. Give them some autonomy, as you said just now, but it is making them feel they're part of the process. Like taking them to go pick out their clothes and their school supplies, doing the dry runs and everything else. And something that struck me, Dr. Thint, when you said about that, and by the way, we're going to run a little bit long here. We started a little bit late. We're also going to run a little bit long. I hope y'all don't mind. So if you have an appointment with either of these doctors, they're going to be a little bit late. So, or you can just chime in, ask your question here, and we'll just have a virtual visit. No, but I wonder along that same lines of, you talk about live by example.
Yes.
I've covered many first day of school, and I always kind of pick out the elementary, because those are always the cute kids, to interview the parents and stuff like that, and watch the parents are kind of. And you talked about that your kids are going to feel anxiety and everything else. But one of the roughest spots, let's get past the first day of school. Let's just talk about by the third week, and there's some parents gone the wrong direction in the car line, or something's happened there. And, now things, the behavior, and I've heard this from teachers and I've seen it myself, the behavior in the car line sometimes by the adults is not something you want any kid to take an example of. It's got to be a memory of, hey, you drop your kid off at school. Let's not stress out totally. It's not the end of the world if the person in front of you cuts you off or is taking too long.
Same as in sports, right?
Yeah, same thing. Yeah, it's the same thing. Yeah, and we're getting into the time where everybody in the stands knows more than the coach on the sideline. And that's part of it too. Is at some point you got to kind of make a, remind yourself. Yeah, you may be running behind, but you knew this date was coming. It's like you knew you got to drop your kid off, so your planning needs to be better on that. But it take that responsibility of just being calm. There's no way I think most of these folks are going to be calm, but don't take out your stress of the day and let your kids see it when you drop them off at school. And because you never know nowadays, I've seen it firsthand on many days when I've gone to campuses and I happen to get there early and I'm watching it, and I just kind of sit back and watch them, because I do kind of think it's kind of cool to watch how different people react with their kids. But I also love it when the kid sees their favorite teacher and just runs up and hugs them, and this is like 8 weeks into the school year or 5 months into the school year, they still are hugging the teacher, because that's their favorite teacher, which is great in itself. Dr. Thint, I want to talk to you as well, because there's some other things we hadn't addressed yet that I think are good. There are things simple that I don't think a lot of people think enough of. They think they know it, but maybe not. And that's child seats and booster seats. And I don't know these rules either. But what's your recommendation on child seats? What age group should be in those child seats? And I'm assume it's always back seat facing backwards. Is that the best way or not?
Depends on the ages, right? When when the baby is discharged from the nursery after day 2 or day 3, they are in a rear-facing infant car seat. And most car seats will accommodate up to 20 pounds or maybe 24 pounds. So rear-facing, and then you can transition to a bigger car seat, 5-point harness, which is the safest. They will be rear-facing until age 30 months, which is 2.5 years. And the reason is because of the stability of the cervical spine if they were facing forward, there's a sudden stop. You can have whiplash, and that can cause injury to the cervical spine, and that can cause some neurological injury to the spinal cord. So rear facing until 30 months of age, and then you can forward face after that. And it used to be that you stay in a 5-point harness car seat until age 6, but now the later recommendation to keep them in as long as you can, even beyond 6. So, and then if you transition to a booster, which is just a seat with a seatbelt going from the car, that booster can be from age 6 years old and up. But preferably, even a 6-year-old should be sitting in a 5-point harness car seat. And when does this child come out of the booster seat and just go and sit in the seat and just use a regular, seatbelt? Is depending on the height. It's 4 foot 9 inches tall. You are okay to transition. All of these data, I did share a link there, come from all the highway safety crash reports and all that. So, and then again, the other part is what's the age to sit in the front next to the driver? And 12 to, you have to be age 12 birthday beyond 12 years, then 64 days you stay, sit in the back. The front is 13. And I tell them one of the reasons is because when there's a crash, the airbag comes out. It comes out 100 miles per hour and hits your face and you get suffocated. So, that's super duper important because we see 7-year-olds sitting in the front.
Right. You see them when they get out there, and that's when the mom in you wants to take over, come up and say, you need to not do that. But then you have to remember what your role is, right? And again, don't stress out everybody at the car line. But I understand. Yeah. And that was one of the things I found in our folks know this, we do a pre-interview discussion all the time. And I found it really eye-opening to me is I didn't know the age breakdown. So 13 and older is when they can sit in the front. Until then, back seat. And that's always the safer way because the airbags are on the side and not coming full frontal as you are if you're sitting in the front seat. And we know of many injuries of the impact of those bags. I mean, and even if you had the option of turning it off, that's not always effective out there as well. Now comes the other big one. I started off the show talking about it's hot as heck outside and the like. And I know this is something all of y'all have been talking about with me. I'm ready when I start driving by the high school parking lots and I'm going to see the band out there practicing.
Yes.
And
I know.
Oh my goodness. I get miserable for them and I'm in an air conditioned truck driving by. But it comes into, let's just talk about parents need to be encouraging kids to hydrate. One, I don't think you use the term hydrate with them because they're like, how to drink more fluids, that are good fluids for them. What do y'all recommend on one, how to encourage them? And also, is straight water good enough or should they be getting something like, a Gatorade or a Pedialyte or something like that?
So most of the time, water is the best fluid to hydrate with. And so you're never going to go wrong with water. And kids who are exercising in the heat or out there practicing their band formations, they need to have a huge water bottle with them. We're aiming for no less than 64 ounces, but we probably need more than that when we're exercising out in the heat. So water, a little bit of a low-calorie Gatorade or Powerade or something that's an electrolyte drink would be okay as a substitute for some of that, but we don't want to overdo it on the sugars in those drinks either. So water, that's the very most important thing to prevent against heat illness. And then it's good for kids to know what the signs of heat illness are as well. So make sure your kid knows if they're suddenly feeling really nauseated, if they're throwing up, if they're getting bad muscle cramps, if they're getting bad headaches, if they're all of a sudden just feeling really exhausted, like very fatigued, like they're walking through soup, it's just hard to get anything done. Those could be signs that they're getting overheated and they really need to go cool down. So encourage them to talk to their coach or their band director if they're getting to that point where they can get to a cool space and hydrate and recover. If Also encourage kids, if anybody around them passes out, that's a major sign that they have kind of crossed over from heat exhaustion to we're working our way towards heat stroke there. And those people really need to be attended to quickly, and that needs to be taken seriously. And if those people who have passed out are acting confused or like they're not quite themselves, that person needs to seek medical attention immediately.
Yeah, it's one of those things too, is that I think there's still this kind of mentality when you're a youngster, I can drive through it. It's not, it can get really serious.
It can be very serious.
Yeah. And other ailments can come up from that. On the same time, when you're water, as you put it out there, eat right. And Dr. Nguyen, you know, one of the tough things I know for any parent to do is if you're watching your kiddos and what they eat, but there's that you're kind of watching the calories as well and everything else. They're going to fight you and eat broccoli. I mean, that's just a given until they're 10 years old. There's going to be a fight about broccoli. I don't know. I've heard that change. Actually, your kids love broccoli. I know you told me that. Actually, it just popped in my head. That was one of the things you answered. My kids like broccoli, so I got it schooled again. But Dr. Nguyen, on diet? What do you encourage with youngsters on diet and parents to work with them on that?
Sure. Actually, my favorite resource is that My Plate, because it's simple and it's visual. And, there is actually a website, myplate.gov, and they can, go over everything with you. But essentially, half of the plate, and it's a child plate we're talking about, not an adult plate, is fruits and vegetables. And I always tell people, in terms of vegetables, I would like it to be green or leafy. We don't really count potatoes or corn. That really should be in the carbs or the starch family. And if you're going true recommendations, half of those grains should be whole grain. It's not always a popular recommendation, but it's much better for you. And we want them to be doing meats, lean meats if possible, and then maybe twice a week if they're not allergic, to do seafood. And when you go with milk, we do recommend, skim 1%, 2% milk, but not whole milk in general. That's healthier. And, we really, I think, the ladies were talking earlier about water. That's the best. And we really don't recommend a whole lot of juice. If now you can flavor the water, you can make it, put some fresh fruit in there and flavor, make it taste good for them. But I really recommend that that the parents look at the website, because not only does it give information about healthy eating, but it gives you information about you can go online and actually calculate the calories that your child needs, and it's based on their age group, their weight, and their activity level. So it's wonderful. You put all this into this, and then it tells you this child needs so many calories per day. They also give you like healthy, cost-effective recipes, and then for folks who are interested in like what where are the farmers markets out there, what facilities take what stores take SNAP benefits and stuff like that. Again, you can look all this up on that one website. So it's really a good, useful tool.
And it's important too, because we, more and more school districts are coming online now with the free and reduced lunch, as we used to call it, program, is now just not for select number of students. They're in many school districts. It's no matter who shows up and do that, and go in doing that. So, and I know the Galveston County Food Bank works very hard with a lot of the school districts. Clear Creek ISD among them, by the way, I know, and they are making sure there's food packs to take home for kids on school days, for the weekends, to make sure as well that it's healthy, nutritious, with those fresh foods. And we do have in Galveston County, I will say this, and I know Brazoria County too, Dr. Nguyen, a lot of food deserts around. And food deserts, for those who don't know, are defined as where you can't go get your regular grocery items, and not a convenience store doesn't count unless they have, now, although more and more dollar stores or convenience stores are adding the fresh fruits and vegetables and the healthier items to that through some partnerships. I know Family Dollar's doing it now, and having that grocery side of things. But there's a lot of communities where, because of transportation, you can't get to the location you want to have. So, and if you need the help there, or you think your school could use the help there, or you are in school and you think students could, contact the Galveston County Food Bank, because I know they will work with you. Okay. And the Rotary Club in League City, I know, does a great job working with the food bank to do that. But now comes the most important question about meals for students. Is pizza day okay or not? Once a week.
Once a week. Fried food and pizza once a week.
Wait, same day, or can I have fried food one day and pizza the other day?
Your choice. But that's once a week.
Once a week. Because I just always remember when I went to Texas City, that was the day. When I was in Texas City schools, it was, all right, pizza day. I mean, I didn't care what my mom put in the lunchbox. I wasn't taking it with me. I was pizza day, or I was going to have pizza. And go on with that. So, and I promise you we do this. Okay, so let's make sure we know. I want to make sure no one lost this. And we had Cleopatra. Thanks for coming in and asking us. Cleopatra James came in and asked us, is this recorded? Oh, a lot of folks are saying that yes. As soon as we're done with this show, you can just go back to the beginning and watch it. And it's just been great information. But most important thing, the vaccines you got to get before kiddos go back to school.
Yes. So again, it's always great to check in with your pediatrician and make sure your child's up to date with all of their infant vaccines that they would have gotten before age 2, because they need to be up to date on all of those. And then when kids are over age 4 and before they start pre-K or kinder, they need boosters on their MMR, their chicken pox, their DTaP, which includes their tetanus and whooping cough and diphtheria, and their polio vaccine. Now we can do those, and most offices do those in 2 combination vaccines. So that's just 2 shots. So it's not overwhelming, and it's good to kind of prepare your child before you go for that visit so they have some expectation of what's going to happen. And we'll need those before we enroll in kinder. And then in middle school, when we're over 11 years old and before we enroll in 7th grade, you're also going to need a booster of your tetanus vaccine, as well as meningitis and HPV vaccines are recommended at that time. So the tetanus and meningitis are definitely going to be required before your child can enroll in school. And the HPV is strongly recommended. And then when you get to high school, once you're over 16, and before you enroll in any college courses, which includes a lot of our dual credit classes that a lot of our teenagers are taking, you need meningitis boosters again. And so don't forget about that high school time as well.
And I meant to ask this when we were having this conversation earlier, only because I was seeing in some spot areas where the debate that was going over the COVID vaccine also was affecting what we had forever, like we had a measles, I wouldn't say outbreak, but there was a measles, break that happened in one part of the country that like hadn't seen it in 40 years, that a measles case at all. And then all of a sudden there were 6. And we need to put, yes, folks can have their thought about the COVID vaccine, but everything else has been around tried and true.
For a long time.
Polio, for example, started off with a little cube and then went into the shots that it has now. And when we start seeing that pop, and as a member of Rotary, I obviously pay attention to that. And you see that come in there. But if you need more information on the resources, UTMB actually has a back to school section on its website, UTMBHealth.com, and it's /back-to-school. You have it on your screen there, or you can find it in the comments section to go along. Thank you all for being here, Dr. Goodman, Dr. Thint, Dr. Nguyen. Thank you for all of y'all being on here. I'm going to ask everyone to kind of hold in your spaces here, because I do have a final word on a different subject when we come back on the tail end of this, is referring back to one of our earlier shows. And I'll do that when we come back after this word from UTMB Health.
There's nothing more important than quality health care for you and your family. That's why UTMB Health is in the communities where you live, providing easy access to innovative care. At UTMB, we know our patients need personalized care to lead healthy and fulfilling lives, providing everything from primary care and specialty care to urgent care and emergency medicine. UTMB knows healthcare. UTMB knows you. To find a UTMB doctor near you, visit UTMBHealth.com. UTMB Health knows that when you need advanced surgical care, you want a specialist who's an expert in their field. Our surgeons provide innovative and advanced treatment options for adults and children, for neurosurgery, GI, heart surgery, ENT, urology, and more. UTMB knows surgical care. UTMB knows you. To find a UTMB Health specialist near you, visit UTMBHealth.com. UTMB knows when you're expecting, you may not know exactly what to expect. From that first embrace to all the milestones that follow, we know how important each stage of life is. That's why UTMB Health's obstetrics and gynecology physicians specialize in innovative women's health care through all phases of life. UTMB knows women's health. UTMB knows you. To find an OBGYN specialist near you, visit utmbhealth.com/women's.
And welcome back to Health Care Unmasked, presented by UTMB Health. I asked UTMB, our sponsor here, to give me a personal prerogative. Last month, you may have seen our show dealing with Alzheimer's and dementia. And it was a very worthwhile show, I thought, for many folks who have to deal with that. And Dr. G's, we like to call him around here because no one can get that Italian last name of his real to you know how to do Dr. Tag, but Dr. G, I get in there. His as you see on I'm trying to pop it up on your screen right now. There, as you see on your screen right now, is the head of the Mitchell Center for Neurodegenerative Diseases, and he's also heading up what we affectionately call the Brain Bank at UTMB Health. I do encourage you, if you want to combat this dreaded disease we call Alzheimer's and dementia, to take advantage of that program and contact FG. You can see it on the website there at the Mitchell Center, and you can find it at UTMB Health there. I bring this up because it was going to be something I was going to talk about today anyway. But my father passed away yesterday and had been suffering from Alzheimer's and dementia for several years. And quite frankly, we thought we had a little more time with him. First, I want to commend the folks at UTMB Health. This is where he got his health care and was always happy with what he got here. And he's also attended to where he was staying at a care center at Meridian. But we made the decision and followed through with it on two parts. One, after my interview with Dr. Tag last month, we realized something that we had not done was also to make a donation to the center so that they could do the study of all dementia and Alzheimer's could continue on at UTMB. And Dr. Tag was great in getting that all arranged for us. And we made the same decision for my mother, who is also in late stages of Alzheimer's and in a care center now. At the same time, we also worked with our dear friends over at Carnes Funeral Home for the Willed Body Program, which is basically donating the body for medical science, for research and other needs along the way. This is different than organ transplant. This is for medical research. And it is something that continues on a legacy of a family member. And as I said, I'm taking the personal time now to share this with all of you so that maybe you will think about this for yourself and for your family. It was important for us to make this decision. And the only caveat my father, a University of Texas graduate, made whenever he said we'd do something like this was to make sure A&M didn't get a hold of his body. And so we made sure it stayed within the UT system out there. So burnt orange all the way as we go through there. My father, Jerry Alls, as I said, would have turned 83 on Friday. And along the way, as I have mentioned it here, my wife lost both her parents to Alzheimer's. My mom has Alzheimer's. More and more folks now are finding where we have couples. If you can give to the Alzheimer's Association donation as well, we would encourage that as well. If you would do that, it's an important part of this process as well, and I would encourage you to do so. And again, it's a personal prerogative for everyone. But if you need more information, need more to pass along, the Willed Body Program at Carnes, we did a story about that earlier this year. We'll have it up later. They've done miraculous things. And then it does, I know, felt better for all of us when we made that decision yesterday. And again, I want to thank UTMB Health for not only taking care of my father all these years, my aunt, his sister, who is also his caregiver, is a professor here at the School of Nursing and has been for many years at UTMB Health. And by the way, Dr. Jones of the School of Nursing, if you're watching, she loves her job. Anyway, but we had a fun time celebrating my father yesterday, even in his passing. And we do thank UTMB Health for all they've done. Till next month, make sure you're also standing by. We're going to have a special edition of Health Care Unmasked coming up. The new president of UTMB Health will be joining us in a couple of weeks. And then we'll be coming up at the third Wednesday of the month for our next episode of UTMB Health in August. I'm TJ Alls, I-45.